This enema is used to prevent the recurrence of a certain infection, see difficile-CDI, in the intestines after completing antibiotics. It is made from human stool from screened donors and is believed to work by providing healthy bacteria to the body. It can help decrease symptoms of CDI such as diarrhea, nausea, loss of appetite, and stomach tenderness or pain. It is not used for the treatment of CDI. The recommended dosage and timing for this enema should be discussed with your doctor. This medication is administered into the rectum by a healthcare professional. For best results, it is recommended to use this enema after emptying your bladder and bowel, if possible. One position to use is to lie on your left side with the left knee bent towards the chest. Another position is to kneel, then lower your head and chest forward until the left side of your face is resting on a surface and your left arm is folded comfortably. After receiving the enema, it is advised to stay in your position for up to 15 minutes to decrease cramping that may occur. However, you are allowed to use the restroom if needed. It is important not to take any antibiotics for up to 8 weeks after receiving this treatment unless directed by your doctor. If your diarrhea does not improve or if it does not go away, if you have 3 or more loose bowel movements within a 24-hour period for 2 days in a row, it is important to inform your doctor. If you experience abdominal pain, diarrhea, bloating, gas, or nausea, it is important to consult your doctor or pharmacist. Remember that this medication has been prescribed to you because the benefits outweigh the potential risks. Most people do not experience serious side effects while using this medication. However, if you notice any symptoms of a serious allergic reaction such as rash, swelling, severe dizziness, or difficulty breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. As for the optimal timing and daily dosage, be sure to follow the instructions provided by your healthcare provider. Before using Rebyota 150 ml enema, make sure to inform your doctor or pharmacist about any allergies you may have and discuss any inactive ingredients that could potentially cause allergic reactions or other problems. It's important to also share your medical history with your doctor or pharmacist before using this medication. If you are planning to have surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Rebyota 150 ml enema is safe to use during pregnancy when used as directed. If you are breastfeeding, consult your doctor before using this medication, as it is not known if the drug passes into breast milk. However, it is unlikely to pass into breast milk. When taking Rebyota 150 ml enema, it is important to be aware of potential drug interactions. These interactions could affect how your medications work and increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Rebyota 150 ml enema. Always consult with your healthcare provider before making any changes to your medication routine. If this product is swallowed, it can be harmful and may cause serious symptoms such as passing out or trouble breathing. In case of an overdose, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. Always keep this in mind and be cautious when using this medication. Remember, it's important to use it as directed and never exceed the recommended dosage. Always consult a healthcare professional if you have any concerns or questions about the use of this medication. So, while using Rebyota 150 ml enema, you may need to do some lab and medical tests, such as stool tests. Make sure to attend all your medical and lab appointments. Rebyota 150 ml enema is used to treat constipation and to clean the bowel before certain medical procedures. It works by drawing water into the bowel to soften the stool and help produce a bowel movement. This medication is for rectal use only. Follow all directions on the product package, or use as directed by your doctor. Dosage is based on your medical condition and response to treatment. Use this medication regularly in order to get the most benefit from it. To help you remember, use it at the same time each day. Do not use more of this product, use it more often, or use it for a longer time than directed by your doctor. If you have any questions about your condition, talk to your doctor or pharmacist. This product is typically given in a hospital, clinic, or doctor's office and is not intended for home storage or use. It is used to treat certain medical conditions and should be administered by a healthcare professional. It is important to follow the recommended dosage and timing as directed by your doctor or healthcare provider. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.